Every time you turn, there seems to be a new diabetes medication being advertised. In this video, I help to organize and I help you figure out exactly where all these diabetes medications fit in. So stay tuned. If you're new to the channel, if you're new to me, I am Dr. Dwayne Wood. That's Wood with an E, and the E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life, avoid complications, and go to the next level, living that healthy, fulfilling life you've always wanted. This is Diabetes Awareness Month. Every November, not me, but all of us in the community go about educating. So dispelling myths that may be out there and helping people to understand that they can prevent the progression to diabetes. And if they have diabetes, they can decrease and eliminate the complications. Notice what I said, the complications of diabetes, and live a long, healthy, fulfilling life. So far, I've been doing videos throughout the month. If you've not already done so, there is a playlist on the YouTube channel that's called Diabetes 101 Series, Diabetes 101 Series. And all the videos that I've done so far for the month are in that playlist. Go back, once you're finished with this video, go back and watch those and come up to speed, because I've been walking through very deliberately working with each different area of diabetes, so that you can make sure that that you get that right. So in bite-sized chunks, so not big long discussions, but just very small bite-sized chunks, so that you can digest that. So go back, take a look at that. If you know anyone who has diabetes, go ahead and send this to them. Let them know what I'm doing on the channel. Let them know what's going on for this month, and you know, send it out. All right. So it's my challenge for you today. Now, I've been walking through, and we've talked about, and let's hop over to our slides. So today we're talking about prescription medications for diabetes. And, you know, there were three things that I said that we have that we use to treat diabetes, three types of options for diabetes treatment. And you'll see those there: lifestyle modification, non-prescription treatment, and then today in this series, we begin talking about prescription medication. Okay, so prescription medication. So just to remember that, let me pop back over here. The treatment for diabetes, comes in all of these different flavors. Now, there are some specific things when we talk about our patients who have type 1 diabetes that we want to make sure that you know that the type 1 is an insulin requiring disease, which means that they have to have insulin. Now, there are things that we can do to decrease the amount of insulin that they have to take, but ultimately they do need insulin. So it is not currently possible. It is not currently possible for us to use these other mechanisms, these other treatments, to totally eliminate the need for insulin in our patients who have type 1 diabetes. Now, for type 2 diabetes, it is certainly possible. Okay, and I'll talk a little bit about that at the end as we get to the end of this part of the discussion. All right, so I popped this up earlier, and this is an algorithm. And the algorithm is, how do we treat diabetes? And it has a bunch of lines and some things there. This is the one that is from the American Diabetic Association, right? That they update every year, right? So every January, around December, January, into February, they come out with new recommendations. And the recommendations, as we learn more information, and let me say that, as we get and as we learn more information, we're always updating what we are telling the people, what we are telling you, what we are saying, and how we treat. So currently, we don't have a document that's 100%, all the knowledge for every aspect of diabetes, right? We are still learning. And as that information comes out, that's what is put out to the public, right? So every January, Diabetes Care is what the document is called, or the journal, Diabetes Care, and they put that out every January and update what we know and what our current recommendations are, right? So that comes this diagram, this page that you're seeing comes from that. Now, there's another organization, right? So there's the American Diabetes Association. There is the American Association of Clinical Endocrinologists, and they put out recommendations as well. And most of the recommendations coincide with each other. I'll point out one that's a little different here in a minute. And then, of course, there are other organizations. Remember, there are almost 500 million people on the planet that have diabetes. And so here in the United States, we have organizations, and then around the world, right? So the European Union has an organization, right? So, and they collaborate with each other, but the recommendations may be slightly different in certain instances. Make sense so far? Okay, good. Well, the one that I want to kind of go through, the one that we're going to use is this guy, and this is adapted and adopted from the American Association of Clinical Endocrinologists. Now, if you go and you find their algorithm, right, much of what you see, and I've simplified it. So that's the difference. I've simplified it. There's some lines that you'll see on theirs that aren't on this, but just a simplification, right? So we're talking about prescription medication, and the idea behind prescription medication is that we've done, or we are currently doing, all of the other things that we've talked about, right? So we talked about lifestyle modification. We talked about what that means. And we did 2 shows, I believe, on that. So go back and watch those after you finish with this one. We did a show on non-prescription treatment, right? So go back and watch that one. And then if we're doing those things and we still have blood sugars that are elevated, then there's medication, right? Let me pause here. In type 1 diabetics, once again, like I said at the top of the show, is an insulin, or type 1 diabetes is an insulin requiring disease, right? So patients there need insulin. So the other things we can do, minimize the amount of insulin that we need, but ultimately they need insulin. So as we get into prescription medication, the diagram that you're seeing is with the intention of, if we're doing all the other things, right? So we're exercising, we're managing our stress, we're managing our sleep, we are managing anxiety and all the things, are decreasing our cortisol, and we're watching the carbs. If we're doing all those things and we still have high blood sugars, then medication is there, okay? The other idea that I want you to get is that medication is a tool. It's a what? It's a tool. It's kind of like, in my garage, I have a toolbox, and more than one toolbox. And I've got tools on the walls. I've got, wrenches, and I've got, all clamps and just everything all over, right? I've got power tools that are plugged in. I've got a, extension cord that's running across, and I've got to get out there and fix it up. But that's a whole nother story. But anyway, in the toolbox, right? Let's take one particular toolbox. I've got a bunch of tools. I've got screwdrivers and pliers, and I've got hammers and chisels, and I've got all kinds of things in there, right? A measuring tape. Now, my life doesn't really call for chisels a lot, right? And I'll go in there and I'll grab the hammer and do something. I'll grab a screwdriver, I'll grab a pliers, but really not chisels, right? But it's in there if I need it. And that's where medication fits in. Medication is there. It is a tool in the toolbox, and it's there if we need it. Now, why would someone need medication? Well, some people can't exercise. Right? Some people can't exercise, but they're diabetic. So if for some reason they've got backaches, back pain, they've got some residual from a stroke, and they cannot exercise, then that takes away one of the tools that we've already said that we need to manage diabetes. So if we can't use one of those tools, then we've got to rely on other tools, right? So that's an example. Some people have restrictions in their diet, and there's certain things that they can't do, and so they need medication. Some people, their blood sugars, for instance, when they are first diagnosed, are out of the, off the charts. And so they initially need medication, right? So medication fills a spot that is a very real spot, right? So we want to make sure that you understand that there are all these other things that we do, but we may end up needing medication, okay? Talk more about that, like I said, at the end. All right, so if you look at the diagram that you see on the screen, at the top, you'll see lifestyle therapy and ongoing glucose monitoring. Lifestyle therapy and ongoing glucose monitoring. That means that as we talk about medication, I want you to know and I want you to remember that lifestyle is always the first place that we go. It's always the first place that we go. And it is the basis for all the things that we do after that. So while we're talking to you about medication, we're also telling you, hey, you got to eat better, exercise, manage your stress, get good sleep, right? Deal with your inflammation. All of those things are still there. They're part of the foundation. So this is not instead of, this is on top of, okay? So in addition to. All right. So the idea behind the treatment of medication is that when someone shows up who has diabetes, and most people, we've talked already about the progression from insulin resistance, prediabetes, metabolic syndrome, all those things. And so now someone is diagnosed with diabetes. And diagnosis of diabetes, once again, is an A1C that is 6.5 or higher, a fasting blood sugar that's 126 or higher, or a blood sugar after an oral glucose challenge of 200 or higher, or anyone who has a random blood sugar of 200 that has symptoms, right? So all those things can be indicate diabetes. And there's a show that we did on how do we diagnose diabetes, so go back and watch that. It's in the playlist. So someone is diagnosed with diabetes and they show up. And the question when they show up is, what do we do? All right, what do we do? As I mentioned, we're always, did I say always? Yeah, always talking about lifestyle modification, right? That is on top of, that is what we do. Someone shows up and we're talking lifestyle modification. But when their A1C, when we look at their A1C, and remember the A1C is the marker of what we're doing, how the blood sugars are. So if you got an A1C that's less than 7.0, you'll see there what the recommendations are, right? Actually, that should be 7.5 or lower. Sorry, that 7.5 or lower than 7.5. Let me say it that way, okay? And you'll see what the recommendations are. And I'll come back and go through those. And then there's a section 7.5 to 9. And we've got certain recommendations. And then over 9, we've got certain recommendations. So this is someone showing up, newly diagnosed, and we talk to them about lifestyle modification. We talk to them about checking their blood sugars. We talk to them about all the things that we've talked about so far. And how do we manage their diabetes? How do we manage their sugar, their insulin resistance? How do we manage where they are at the moment? How do we make sure that there aren't other complications like blood pressure and cholesterol, right? So all that stuff we're talking about right now. And if they have that A1C, right, then we've got to make sure, then we've got to say, hey, okay, this is where we are. So monotherapy means one medication, right? So if someone shows up, A1C less than 7.5, then monotherapy, and you'll see all the lists. And we're going to be going through, not in this section, we're just laying the foundation. We're going to be going through all of the different classes of medications. We're going to talk about what they are, what the drugs are in that group. We're going to give you a list of all the drugs in each of the categories. What are some of the benefits? What are some of the pitfalls that you can have? Right, so we'll go through all of that. So someone less than 7.5 monotherapy, that means one medication. Someone that has A1C that's 7.5 or to 9, 7.5 to 9, then We've got dual therapy, either 2 medications or 3 medications. And then someone who's higher than that, so it's greater than 9, then, and whether they have symptoms or no symptoms, then we do something a little differently. Okay, so that's how we step through. So when you show up to your doctor's office, this is what's going through their head. Hey, let's get this guy, let's get this gal, let's make sure that they are eating well, exercising, managing stress, drinking water, dealing with their inflammation, dealing with their pain, managing their cortisol level, all the things we've talked about so far. So we're teaching that. We're talking to them about the carbs, right? 45 grams of carbs per meal. We're talking to them about combination of carbs, right? So remember, you can eat something that has 1,800 calories with no carbs, or you can eat something that has 1,800 calories with carbs, right? So how do we go about navigating all of that? So that's the background. And then now, okay, let's look at the A1C, less than 7.5, monotherapy, 7.5 to 9, dual or tri-therapy or triple therapy. And then greater than 9, right? Are you having symptoms or no symptoms, right? So we're walking through that. And then under each of those, there are the medications. And the medications really are the same regardless of where you are, except for, monotherapy. If you're down below 7.5, you show up, it's unlikely if you're a type 2 that someone will start you on insulin at that point, but it's possible. But definitely if you are type 1, then we start on insulin, right? And we'll come back and we'll do a show. I mentioned briefly in one of the shows that we did what's called the honeymoon period. And we'll come back and we'll do more in depth on that, right? All right. So let's name some of these and let's give the categories. I'm not going to go through the names right now. We'll come back and we'll talk about that. So metformin, everybody knows about. GLP-1 receptor agonists and big now, GLP-1 receptor agonists, you see those on TV because they are also used for weight management, right? So that's a big group, and there's so much excitement that's going on, and we'll delve into that. The SGLT2s, also a lot of excitement because we're finding that this group of medications, not only are they good for blood sugars, right, lowering blood sugars, but they also help with heart, and they also help to protect the kidneys, right? So lots of stuff going on. DPP4s, they were the new kid on the block at one time, and everybody was up, excited about them. And we still use them, but because of the other two, they've kind of not fallen out of favor. But we don't use them, or people don't use them as much, right? But they are still used. And then the TZDs, and we'll name those. They've gotten kind of a bad rap, and you may know some of these, or one of them at least. And then finally, the SUs, or sulfonylureas, and the glinides. Right? Right now, you don't have to remember any of the stuff that I'm just talking about in terms of the categories, right? We're just listing them. We're going to come back and then you'll have to remember the categories, because we're going to give you not all, but most of the common medications under each of those categories, right? And you'll see as we go to dual therapy and triple therapy, then the names kind of stay the same. But once we get into dual therapy and triple therapy, we now begin adding insulin. And definitely as we get to A1Cs that are greater than 9, then insulin is there as well. Okay. And you'll see between the groups, right? Between the monotherapy, triple therapy, and then A1C is greater than 9, you'll see it says 3 months. And 3 months is the time when we have our next visit. So I'll see you today, and in 3 months you'll come back and we'll evaluate where you are. If the medication isn't working, then we will talk about, once again, lifestyle modification, and are you checking your blood sugars? And then what do we do, right? How do we advance? How do we move forward? Now, let me jump in to say right here that when we talk about the management of diabetes, right? So we've moved beyond pre-diabetes, right? So pre-diabetes, we're saying, okay, how do we prevent it from progressing to diabetes? But we're full-fledged now diabetes. Our A1C 6.5 or higher. Blood sugars are elevated appropriately in terms of the diagnosis. Okay. And now our goal is to get your A1C down. And remember, we're shooting for 6.5. And this is one of the differences between the American Diabetic Association and the American Association of Clinical Endocrinologists. But it's not a big difference, right? The ADA says, hey, we want your A1C less than 7. The American Association of Clinical Endocrinologists, or ACE as it's called, because I won't keep saying that full name. So ADA, American Diabetic Association, and ACE, American Association of Clinical Endocrinologists, they say 6.5 or high or lower, right? Both below 7. And if you shoot for 6.5, you satisfy both. Okay, so right there. So as we are working to lower the A1C, remember we did a show. Why are we bringing the A1C down? Why is it so important? It is important because we know that if we can decrease the A1C, we can decrease complications of high blood sugar. So when you show up and you have an A1C that's higher than the specified goal, then we want to get it down. And that is what we're trying to do. And we will do everything we can to get it down. Right? So if you're out there, don't get mad with your provider when they keep saying, okay, we gotta get the A1C down, right? And we need to work to get it down, right? Simply saying, let's get it down is not gonna be any benefit if we don't work on a plan, if we don't have a plan of how we do that. Okay? So this 3-month time to say, hey, A1C is high, let's intensify the therapy, let's move the therapy, let's change the therapy, let's whatever movement we need to make. That's what we've got to do. And it's kind of like everything else in your life. Everything else in your life. You're trying to buy a house and you're trying to save money. You are moving in a direction. You've got a plan, right? You got to save this much money over this much time so you can buy the house. You want to buy a car, right? You're going to college, you're in school, you're getting a degree, you're taking a class, right? You're trying to move up in your company. You're trying to get your A1C down. It falls exactly like the other things that you do. And so that's our goal. Get the A1C to goal. Yes, it's great that it's moving, that it's not 9 anymore, that it's not 10 anymore. Now it's 8, but let's move to 6.5. We're not stopping at 8. We're not stopping at 7.5. We're moving to 6.5. Now, there are some people, and we used to, right, say, everybody, we need to get all your A1Cs down. And for the most part, that is true. But as we look at certain patient populations, people that are elderly, that may not be in the best of health, who've had A1Cs that have been high for a long time, who are already having significant complications, then sometimes we'll look at them, and we're talking about individualized therapy now, and we'll say, okay, we're going to allow their A1C to be a little bit higher because we don't want to cause any additional complications. For instance, there are some people who, for some reason, they go low very easily, particularly as we're talking about our older patients. Right? Their blood sugars drop, a lot and, significantly, and there's a danger when it goes down. So we will allow them to keep an A1C that's slightly higher, which represents a slightly higher blood sugar, right? So those patients, right? And once again, in all that we say, and all that I say, make sure that you're talking to your healthcare provider, right? And they can help direct you. But for the most part, our goal is to get that A1C to 6.5. 6.5. Okay. All right. So once again, therapy, lifestyle, all the things that we've talked about, right? Now, notice I haven't said much about the ongoing glucose monitoring, right? That's I haven't said much about that. But lifestyle, right? All the things in lifestyle. You show up, A1C is less than 7.5, monotherapy. 7.5 to 9 to 9, dual therapy, triple therapy, and greater than 9, right? Then depending on symptoms, we do dual therapy, triple therapy, or insulin. That's someone who's showing up new to the system. They were just diagnosed. Now, if you've been in the system, you've been diagnosed, you're a diabetic, you've been there for a year, 2 years, 3 years, 4 years, 20 years, right? We're no longer in the monotherapy necessarily, unless you fall in that area, right? So if you've been with A1Cs of 12 and you're showing up, right, you don't fall in the less than 7.5. You fall in the other places, right? In some of those other categories. And that's where we go. Now, it is possible to have an A1C that continues to improve over time. And once it improves over time, then, and here's the thing, everybody thinks once you're on a certain medication and once you're on insulin, once you are on 2 medications or 3 medications, you're stuck there. That is not the truth. Because the amount of medication you're on is directly related to your A1C. Your A1C is directly related to the blood sugar. So if you get better blood sugar, better A1C, then guess what? Not as much medication. Once again, specifically for the type 2, type 1, possibly true with the caveat that it's an insulin requiring disease process. Okay? All right, love it, love it. All right, and then we're going to come back, and this is where we're heading, right? This is where we're heading. So when we talk about prescription medication, right, we're going to talk about the oral medication. We're going to break that down. We're going to talk about all the different categories that are there, right? We're going to talk about non-insulin injectables, right? So there are some medications that are injectables that are not insulin. And sometimes that confuses people. Well, I'm taking insulin. Well, no, you're not taking an insulin. You're taking a non-insulin injectable. And we'll talk about that. And this is the category, well, that everybody's, yeah, let's get that because this also helps with weight, right? And then we'll talk about insulin. We'll go through those, talk about how they work, talk about what they do, the different types. We'll give you the names that are out there. And then I cheated a little bit here because I threw technology into prescription medication, right? Because a lot of technology is prescribed, right? So I threw it here because it helps support some of the other things that we do, right? And in this discussion, and I may keep it under technology or do a separate discussion about meters and blood sugars and so forth, right? But this is where we're heading. So come on back. This is information. You see it on TV. Sometimes it may confuse you, but we're going to take some time and we're going to walk through it together so that you understand. If you've got questions, if you're out there, send them in, right? Send them in. You know where we're heading and you've got questions about particular medications, go ahead and do that and send them in as well. If you're out there, if you are from one of these companies that make these medications and you want to send a message, you want to send maybe questions that you're getting, right? This is a good place to do that, and I'll be sure to answer those. If you have people that you know that need to know this information, go ahead and send them the link, send them the channel, and I'll come back here in a minute. Now we'll talk a little bit more about what you can do and how you can do that. But this is a great place for us to head over to our amazing question wheel. All right. So if you've been with us, you know the question wheel. If you haven't, let me explain. So on the screen, you will see the wheel with the questions. And I'm going to spin the wheel, and whatever question shows up when the wheel stops is going to be the question that I answer. Okay? And I've got to give you a concise, usable, practical, real answer. Can't be any nonsensical thing, right? And I have 45 seconds. That's the thing. I've got 45 seconds to answer it. Well, I can think about it, but I have to answer it within 45 seconds. Let me say it that way. All right. And then I'm going to take that little clip that I do when I do the answer. I'm going to cut it out. I'm going to make a little video, and I'm going to post it on our social media platforms. And you'll see our social media name under my name there, Dwayne Wood MD, Dwayne Wood MD. And you can find us on all social media platforms. Well, not all, but Instagram, TikTok, Twitter, Facebook, of course, here on YouTube, and LinkedIn, right? So all those places you can find Dwayne Wood MD. So go out. So when you see this, when I'm finished, I'm going to post it, not right then, but I'm going to create it, post it. So go out and look for it. And when you find it, in the comments, I want you to put hashtag I was there. Hashtag I was there. Okay, so that's what I want you to put in. So let us know that you were there. Okay, so let's go ahead and let's spin the wheel and let's get our question answered. Let's see. Okay, here we go. Round and round and round it goes. Where it stops, I don't know. I love saying that. Yeah. Okay, there he goes. Said, can I play sports if I have diabetes? Now, that's an excellent question. Can I play sports if I have diabetes? So let me process, let me think about that for a sec. So can I play sports? Okay. All right, so let's get our 45 seconds on the clock, on the screen, and then I will answer that question. So let's see. 45 seconds. Here we go. So can I play sports if I have diabetes? So can I play sports if I have diabetes? Yes, you can play sports if you have diabetes. There are so many athletes that are out there in a variety of sports fields that currently have diabetes, type 1 or type 2 diabetes, and they are excelling in their sport. So having diabetes does not preclude you from playing sports. All right, so I think I got it. Look at that. I got more than almost 15 seconds. Yay, right? So I did that in about 30 seconds, I think. Wow, I love that. Love that one. Okay, there we go. So anyway, so I'm going to take that. I'm going to clip it out. We're going to send it or post it on our social media platforms. Go out, find it. Hashtag I was there. Hashtag I was there. All right. All right. So many people are able to manage their diabetes without medication. But for those who need it, I want you to work on minimizing how much you need. I will continue walking through and making some sense for you the list of medications that are out there. And talk with your family doctor, talk with your healthcare provider about what you can do to minimize the amount of medication you're on, and then talk with them about the medications that you're currently taking, right? And what's the best way to use them. Ultimately, our goal is to help you live a long, healthy, fulfilling life. And as we talk about diabetes, right, we want to prevent the progression too. But if we have diabetes, let's see how we can minimize the complications. All right. So I'm glad that you're here. If you have not already done so, please go ahead and give us a thumbs up for this video. If you're getting benefit, give us the thumbs up for the videos that we've done so far. Go back and watch all the ones that are in the Diabetes 101 series playlist that you'll find on our YouTube channel. If you've not already done so, go ahead and subscribe to the channel. Hit the bell so that you will be alerted when new content comes up. And if you're not on YouTube, go ahead and create a free account and then subscribe to my channel and hit the bell so that you'll get notified. And then the last thing that I want you to do in this series, in this process, is if you know someone, or even if you don't know someone who has diabetes, share the information that we're getting. Send the playlist. Send the YouTube channel, right? Say, hey, you've got to come and you've got to listen to this. This information is important. And this month we're doing diabetes, right? But we did so many different things leading up to this month. Last month in August, we did 30 days worth of mindset and life-changing, designing a better version of ourselves, right? And throughout the year, I've been doing videos, right? So in August, the channel celebrated 2 years. So we're into our 3rd year now, right, of content, right? So there's a lot of stuff out there. So go out, you're going to find something. If you have some topic that you would like us to cover, I would love to hear that, right? Send it in. Send it on any of our social media platforms or dwood@dwaynewoodmd.com. That's dwood@dwaynewoodmd.com, right? Send that information to me, and I love to answer those questions. For our amazing question wheel, if you have questions, go ahead and send those in as well. And I will put those on the question wheel, and we'll give you a shout out if that question comes up, as it spins, and we'll give a shout out to you, all right? So I love doing what I do. I love doing what I do. I love engaging with you. I love when you watch. I love when you're here, right? So thank you for coming. Thank you for watching. If you're watching in the replay, go ahead and put #replay, right? #replay in the comments. Thank you once again. This is Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. And here on the channel, I educate, I empower, and I encourage you to take charge of your health, your life, avoid complications, go to that next level, live that life you've always wanted, living that dream. Thank you so much. Have a great night, and we'll see you at the next visit. I always say next visit, right? I say that when I'm leaving the room for a patient. So I'll see you at the next video. Good night.